You know, I like a good debate, but I don't really think I'm qualified to question Bill Gates. And when I look at what he says here, I think he brings up a pretty good question. Now, just wouldn't it be nice if your workforce, if the people sitting next to you, every day were happy and healthy? I think it's a nice idea. And luckily, I came to YSI, and I met 4 other people who felt the same way. We came from different backgrounds, we have a diverse set of expertise, but we all thought that the answer to that question should be yes, because we think everybody should be able to be happy and healthy every day. With that, we found Decdis. Decdis tries to tackle the 3rd UN Sustainable Development Goal. That's health and well-being. Our vision, you're going to hear the words a lot, but it's for happy, healthy, and productive people. We see this especially in closed spaces. We want to go to companies and help them stop as close to patient zero as possible the spread of disease in their office. We want to go to schools to prevent kindergarten from contracting the plague because disease spreads so quickly there. We want to go to homes. We want to help people everywhere live that dream. Today, however, days, weeks, months go by where that's not really happening. The U.S. spends $7 billion every year on sick leave from the flu. 10% of sick leave in general in the U.S. is due to the flu. Meanwhile, 90% of employees admit to going to work while sick, and over a third of them admit to having less than half of their normal productivity. And to be honest, I'm not surprised. Our offices are filthy. The average desk has about 400 times more germs than a toilet seat. Think about that. I'm not surprised how easy it is for diseases to spread in offices when they're just absolutely disgusting, to be honest. I mean, this is a beautiful building, but this isn't sustainable. So what are we going to do? Well, we're going to map disease spread in real time. And it's not just going to be a static image. It's going to be a trend. We're going to look in the 70s when newspapers came about. And then as the internet comes about, we're going to get to the meter using IBM Watson and the Weather Channel to see how pollen and illness can spread in real time. Most recently, we have social media. With that, we have the power of word processing to use just one tweet to get a disease, a location, and number of people affected. It is a powerful tool. Decdis wants to bring all of these together, both open source government data, the opt-in ability for a company to provide us with the history of their sick leave, both from emails and phone calls, social media, geographic data from disease spread and allergen spread, and we also want to put hardware in offices to track inter-office conditions such as mold and other gases. All of that will go into our proprietary artificial intelligence algorithm, in which we'll be able to gather insights specific to companies to send to their HR departments. The departments will then have the tools they need to make the measures that are needed. Right now, companies aren't doing that good of a job at this. You should invest in a workforce culture of good health and well-being. It makes sense. But you should also invest in having your employees being healthy and being productive. The average employee getting sick for a week costs a company about $2,000. That's $837 up front for the sick leave, and $213 per day in lost productivity. And this is for the US and Canada. So what's Decdis want to do? Well, first, we want to give real-time disease prediction. We're going to do that. We talked about all of the nodes. Social media, Twitter, a PLOS study found that it reduces the error in tracking disease up to 30%. But we've also looked at a few other studies, tens and hundreds. We've learned from Harvard that when one company introduced an exercise program for their employees, their health premiums went down $1,400 per worker. A Stanford Medical Journal review found that women are actually more receptive to the flu vaccine than men. With these insights, we'll help you allocate your healthcare budget. We'll tell you that you should spend a few extra dollars subsidizing flu vaccines for your female employees, and maybe a few extra dollars bringing healthy food for men. We'll tell you to the week that you should be paying your workers, subsidizing their gym membership. We're also going to give you the ability to implement proactive measures. Remember how dirty offices are? Well, you may be surprised to hear that they're only cleaned once a week. We can tell you to the week, using historical trends, when it's worth the extra money to do a hard clean all 5 days. And we feel validated in that first point by the studies. And I think this validates our second point. The introduction of hygiene intervention in an office reduces the spread of a virus by as much as 80%. We think we provide great value, and we also think we provide great impact. We see a twofold revenue model ensuing. First, a monthly subscription. Companies will pay us on a monthly basis for our insights. Also, in our pilot countries of the US and Canada, where insurance premiums can go down when the companies don't have to pay as much, normally due to a healthier workforce, we expect to take a commission on that expected reduction from companies. In the next 6 months, we expect to have a minimum viable product delivered to our pilot company. In the next year, we'll be incorporated, have a board of directors, and have our first paying customer. We've talked to some of the biggest companies in Norway and Europe. We've heard what their HR department said they want and they need to better manage their people. We've spoken to potential partners. To the people today, we want you to join our cause. It's 2017. You shouldn't worry about your kid going to school every day with the possibility of getting sick. You shouldn't halt an important employee discussion because somebody's sneezing. We want to prevent the preventable. We want to allow everybody to communicate in a connected world. We understand that this is a big idea. We know you'll have questions, but we're going to do it. We're Decdis. Thank you.
7 minutes, point 49. I think it's because I pushed it on 7 minutes.
It's okay, Dieter.
I'm sorry. So, any questions from the jury?
Hey, I thought this was an absolutely terrific idea and approach, and as you push this forward, this is something I would like to be close to. One thing I was wondering is whether you have thought about health systems as a partner, or even in markets like in Europe where the government have a big stake, whether you could engage that type of partners.
Thank you for the question. We definitely understand that each country has a different culture. We learned from talking to companies in Norway, working on wellness and mental health is more important. In the US and Canada, it's more health related. We've definitely thought eventually about Europe. Just like we're using open source data, we eventually want to work with governments to make our data open source. We think we can provide valuable insights, especially with travel related, when companies send employees to conferences around. We think we can provide valuable insights to health systems, like you said. We don't know where that will be in our timeline exactly, but it's definitely something that we think our APIs will allow us to do.
Yeah, great pitch. I think I'll go home and clean my desk right away. So I think HR is like a great target. Like they spend pretty serious money on tools and other things. My feeling though is HR is very kind of reactionary. In all your research, are they doing anything to be predictive with the solution? Is there any other, maybe not the same thing or as sophisticated, but what else are they doing to be more predictive and not reactionary?
Yes, surprisingly, we haven't found a whole lot. We've found that companies have taken, just like they've thrown a dart on the board. Some of the studies we mentioned with exercise programs, healthy food, that came from studying companies that tried that. We haven't really found any software like ours. There's a company in Canada called Blue Dot. Won't admit we have one quasi-competitor, but they don't deliver this type of software. They just gather information. We haven't found anything that really compresses it to allow prediction, which is surprising. So there are really two places that aggregate data like ours, but we haven't met an HR department that we've talked to that has said that they try to predict it in real time. In fact, what we've talked to from the companies we've spoken for, they've said that they just try to kind of, especially we've spoken to companies in Norway where, I was shocked to hear that I could have a masseuse once a week if I moved to Scandinavia. And they talk a lot about how they can help wellness, but they don't talk about specific targets for that. So that's what we've learned so far.
We have time for one more question in this group.
Actually, two questions. One is, I would have liked to know a little bit more about the team. I thought, and by the way, I thought the pictures were really good, but I would have liked to know a little bit more about the team to understand, whether, how you try to understand how you go forward and what you have of capacities within the team and what you eventually would lead. And number two would be what you see as one or two of the major challenges you have going forward.
So the first question first, we don't really have a lot of time, so I don't want to give too big bios, but please come and talk to us after. Everybody, we've the coding prodigy of Bosnia.
Business, research.
Exactly. That's the cliff notes, yeah. Exactly. For challenges we have going forward, I'd say the biggest is essentially just finding a good pilot company. What's really important for us is a company that has taken pretty meticulous notes on when their employees have gotten sick, and even is going as far as symptoms. That will allow us to really have good test data, and really allow us to give good insights pretty much within 6 months as opposed to within 18 months. And the same thing in the US and Canada. And then a second challenge I give, really getting that impact in the second and third phase. Once we have schools involved, we'll have parents, we'll have kids. It makes sense to go to homes. That's where it gets a little tougher to track internal systems. So down the road, we definitely see things, but we're optimistic.
All right, thank you so much.